Thank you so much for tuning in today for our Flint community webinar on coronavirus. We appreciate those of you that have joined us every week, and now we're in week 15, and we certainly are excited about today's webinar. For those of you that have joined us for the first time, the Healthy Flint Research Coordinating Center is a multidisciplinary partnership that is coordinated by a strong community core along with University of Michigan, Flint, Ann Arbor campuses, as well as Michigan State University. And the team has worked very hard to bring to you quality programming, so I trust that you will enjoy today. For those of you who are joining us by YouTube, we appreciate you for coming on. And because we do allow in the webinar for individuals to go into the Q&A and ask questions of us, we're going to invite you, if you have a question, you can text your question this afternoon to 810-835-2130. Again, that number for you to text a question is 810-835-2130. And for any information that you'd like to have us follow up on and know more about, you can also go to the HFRCC website, which is info@hfrcc.org. There have been many questions that have come in through the webinar, and so certainly we want you to feel free to do that today. Just go down to the bottom of your screen if you're in the webinar and type your question in. Last week we had a tremendous webinar that was focused on hospital systems and what they're doing. And so again, we want to expand that conversation. And for those of you, I did not say this, my name is Yvonne Lewis. I am your moderator today, and I am one of the co-directors for the Healthy Flint Research Coordinating Center. But we're joined by a tremendous panel every week that will help us address the questions that you might have. For those of you that are not able to see, we have a list of those panelists up. They range from the governor's office with Gary Jones, Genesee County Health Department, representatives, Hamilton Community Health Network, the City of Flint, Community Foundation of Greater Flint, Office of Equity and Minority Health at the state of Michigan, also are on as panelists. We're representative from the University of Michigan Medical School, as well as the Greater Flint Health Coalition, Michigan State University, and the Genesee Health Plan. There are others who will also be joining us today as well. Today, we'd like to just bring to you a couple of things we want you to think about. We're going to give you an update on where we are with the coronavirus and our reopening. This is an extremely important conversation we want to have with you today. And I want to also advise you that today we'll be having an interactive conversation. So though we have a list of panelists that will be speaking directly to some issues, there will be some interaction between our panelists today. We also want to talk about testing today. There were questions in our last week's webinar that asked us about the type of testing that was being offered and where do we go. One of the other really critical things that came out of last week's conversation was a discussion about the silent epidemic. And we talked about those persons when we were early on in the COVID experience. Many of us were told, don't go to the hospitals. And now we're finding that people are not going in a timely manner to get the help that they need. So we found that people are dying at home or having illness at home when they really could get some medical attention and need to go to the emergency. And we also talked about patient care through the use of technology. So we're going to re-emphasize a lot of those conversations today. But today we want to begin with this conversation as we talk about reopening. I said it, our resident epidemiologist, Dr. Deborah Furholden, who is also a co-director of our Healthy Flint Research Coordinating Center and wears a number of other hats. It's very important that we discuss the racial disparities and the racial inequity, but also, what is the history about this and what are the things that we need to do to really help make a difference for our community? So Dr. Deborah, would you open this up for us today? Dr. Deborah,
I got it. I'm unmuted. Hi, everybody. I wanted to, if we keep going, I'm going to go through this very quickly. I want to make this point super duper clear for people. We are far from this pandemic being over. Myself, I always feel like Dr. Reynolds and I should have like a little duet band. We keep telling people we are in the middle of this pandemic. It is far from over. If you look at what the national data are telling us, what we've seen is now reaffirmed what many of us knew, which is that premature reopening was going to lead to a spike in coronavirus cases and everything that comes along with that. Increased cases equals increased numbers of people who are being sick, increased hospitalization, and increased deaths. And yesterday, the day before, and the day before that, we topped out and hit the highest numbers of new coronavirus cases that we had hit since the pandemic started in the United States. I don't know if people have been following the headlines. The governor of Texas, who was Mr. It's, everybody has rights. People should be able to, re-engage. We've been saying that they put profits over people in this rush to reopen without the thoughtfulness behind it. We are now seeing that. So I want to underscore for people, we are in the middle of the pandemic. Please keep moving forward. Our NIH infectious disease director, Dr. Fauci, has said the disturbing surge that we see now is sending the signal to Congress that the virus is not under control. And I just want to really underscore this for people, because I know people have gone stir crazy. I know people want to get back to some semblance of normalcy. The rush for us to get back to what things were like before, all that does is increase the likelihood that people who are actively shedding the virus and actively able to infect others, it just increases the chances that somebody who has not been exposed will come in contact with them. Next slide, please. Okay, while we do that, I'll just keep on going. So here's the big update on where we are in the pandemic. The cases nationally are increasing. We know that, and it's primarily linked to the premature reopening. Currently in Michigan, we are in stage 4 of the governor's reopening plan. I want to make it real clear for people, though. We are in the middle of this pandemic, and just like we're in stage 4, if we start to see a continual increase in cases, what's predictable is we're gonna have to go back. And then it's very possible that where we are, similar to what's happening in Texas now, they're going to have to go back to what they were before they started opening up the state. So now, even more than ever, it's more important that people honor all of the protective protocols, wash your hands, boost your immune system, shelter in place to the extent possible, clean all your high-touch surfaces, stay abreast of the current information, and do what makes sense for you and your family to stay safe. I know Suzanne Kupel is going to give us some updates on what the numbers look like in Genesee County, which I think are very relevant for us. But that's sort of the update, folks. We're in the middle. This is far from over.
Thank you, Dr. Deborah. That is so true. And we want to be sure that we don't minimize the current situation that we're in. We know we all want to get out. Weather is nice, but it is so important for us to continue that when we protect ourselves, we're also protecting others. So the question about where we are, Suzanne Kupel from the Genesee County Health Department, we're going to ask you to come on, and we're dealing with other technology. So let's just go to that view and Suzanne, can you come and talk to us about what's going on right now in the county?
So a reminder to everyone that as of yesterday, we posted to our website 2,147 positive COVID-19 test results with 259 deaths. And again, it's not reflective of all the number of COVID-19 cases that have likely been in our community. It is reflective of who was tested. And remember that we've had limited testing availability. I will share with you that when we started working on expanding community testing based on the expansion of that testing criteria, at the beginning of May, we were about 4,000 tests in Genesee County. We are now over 15,000 in that short time frame of May and June. So testing is critically important, and we do have locations that are available. The Rite Aid Pharmacy in Swartz Creek is available. The Rite Aid on Clio Road in Flint's available. Hamilton Community Health Network has their North Point Clinic, and they are working from the fire station at the corner of South Saginaw and Bristol. We still have Michigan Health Specialists with 2 locations, one in Burton and one in Flint, and the Walmart on Corona Road. The Mott Community College location will be ending at that particular test location tomorrow. And so we are working on additional testing sites, and we want to make sure that everyone's aware of them and can access them. We in Genesee County have seen small fluctuations in the number of cases. We haven't seen any significant spikes, but I want to remind everyone that once you've been exposed to COVID-19, there is an incubation period that can be anywhere from 2 days to 2 weeks. And also remind you that when someone's being tested for COVID-19, it can take a few days to a week to get a test result back. So there is a lag time between when you see increases in numbers, when someone actually becomes ill, and then when we actually get the test result. So right now is a critical time. We are monitoring carefully because we are reopening the economy. We've had a number of people that have participated in protests, and this is a time frame where we continually remind everyone to be vigilant, to practice social distancing, wear a face covering, wash your hands, use a hand sanitizer that's at least 60% alcohol. Don't touch your face or eyes or ears frequently. Clean those frequently touched surfaces. We also have reminded everyone about 5 key messages, and I'm going to repeat them today. One is the importance of having a medical home, a trusted source of medical information that can help guide you when you do become ill, and someone who knows your health status to help guide you through the process of what you need, including whether or not you need a COVID-19 test versus an antibody test for COVID-19. Secondly, testing is available. We encourage people to be tested and remind folks that there are people who do not have any symptoms of COVID-19. So having that test is helpful for you to know what your status is. Reminder that if indeed you do test positive for COVID-19, we will be doing contact tracing. And it is important that if you get a call from the health department, be it the state health department, the local health department, that you take that call and you share the information about the people that you would have been around while you were sick and when you would have been infectious, so that we can help prevent the spread of COVID-19 and provide education and support to those other individuals. We will never, as a health department, ask you any financial information. So if you get a call like that, you know it's not an appropriate call. Key messaging about prevention. Again, the hand washing, the social distancing, wearing the face mask. We need to continue to do this until there's a vaccine or a treatment, and that is a while away. So definitely need to continue to do that. And lastly,
Suzanne, while you're at that point, I really want to bring some of our other panelists into this part of the conversation. We do have, as a part of our panel today, Sherry Pace from Hamilton Community Health Network, because you mentioned that they are offering tests, and they do offer the antibody testing, and that was something that we talked about. And Dr. Reynolds also mentions to us from time to time that this is not a one and done. So I'd like to ask Sherry to talk a little bit about and give some specifics about how people connect with Hamilton to get the multiple tests, and particularly this antibody test. And then we'll come back, Suzanne.
Sure. Hamilton is currently offering the nasopharyngeal test, which tells you that you have COVID currently. And then we also offer the serology test that tells you if you've had antibodies to COVID-19.
So Sherry, excuse me, but I want to put a pin in that because I want some of the doctors to come back and we can talk about this serology so we understand what that means. So thank you. Please continue.
Okay. So the serology testing that we offer, as well as the regular COVID testing that we offer, we do offer by appointment. So we would ask anyone to call into our COVID hotline, which is 810-406-4019 to schedule an appointment. And we have a provider who will go through a screening process with you and then order the test, either one or both of the tests, depending on how that conversation with the provider goes. And then you would come to either one of our sites for the serology test. That is not done in the drive-through setting. That is done in the actual lab, or you can go to a lab, a Quest laboratory to have that blood draw. In the COVID testing, we are doing that in the drive-through settings at our North Point location and currently at the Burton Fire Station #1. Just east of Bristow and Saginaw Roads.
Thank you, Sherry. So that distinction you made there, so the serology test or the antibody test is not done in the drive-through. I
Correct.
think that's important.
Correct.
I'm going to ask, we have a new face on with us. That's Dr. Benish Patel from McLaren, and we also have Dr. Michael Tupper from Hurley. This question about the testing and how that impacts people when they come to the hospitals. Can you give us some insights on that from a hospital perspective? Dr. Patel.
Sorry, just unmuting myself.
Yeah, I know that. Welcome. This is your first time being with us. We appreciate you coming on.
Well, thank you for having me. Yeah, so to answer, and a lot of this was already covered, there is two different types of testing. Obviously, there's the testing for acute disease, which is that antigen testing, and then there's the antibody testing. Wow, that's a handsome-looking guy there, isn't it? Anyways, the antibody testing is different in the sense that it's really looking to see if somebody has been infected in the past and has since recovered. For the acute testing, that's what we've been concentrating on for the past 3 months, and we're just starting to see a shift into doing the antibody testing. At McLaren, we're still trying to obtain the necessary reagents and testing materials so that we can actually offer that. So we're not quite there yet. The other concern with the antibody testing is that there's multiple platforms, and you have to know what the results mean per platform. A result on one platform doesn't necessarily translate across platforms. So that's something that we're also trying to make sure that we understand, that if we have this company's platform, what does the test result mean? Because you take that same result and it could mean something different with a different company's platform. So a lot of variables that still need to be worked out with that. I think we're pretty clear on what we're doing with the acute phase testing. Because there's multiple platforms for that as well. And so we have a good understanding, and it's not just McLaren, but all hospitals have a pretty good understanding of what machines they have and what the results mean. So that's the basic, and I'll turn it over to Dr. Tucker and see if he wants to add more.
Thank you. Any additions to that, Dr. Tupper?
Yeah, I agree with Dr. Patel that most of the testing that occurs in the acute phase and hospitalization is the nasopharyngeal swabs, the PCR tests, to test for active infection, because that's obviously what we're most concerned with for people presenting to the hospitals, is whether or not they have an active infection of COVID-19. The role of antibody testing is it really is an additional piece of information. There were probably a lot of people in March and April that may have been exposed to COVID-19 or potentially exposed and may have had symptoms, but may have not had access to testing at the time because testing was so limited. And so there's potential reasons to get an antibody test. However, there has to be great limitations placed on the interpretation. We just don't know a lot about the antibody test results at this point. We don't know that a positive antibody test is a guarantee of future immunity. And we also know that with other viruses that are circulating in the community, like RSV and other forms of coronaviruses that aren't COVID-19, there is some potential cross-reactivity in that you may show a positive COVID antibody test, but it's really related to one of these other infections. So the antibody testing is really an additional piece of information. We can use it to incorporate into the clinical picture, and people can use that to make some decisions, but I don't think it's not a passport to immunity at this point. It's you shouldn't take a positive antibody results and go out in public places without your mask, without social distancing, because if an antibody test is no guarantee of proof of immunity. But it can inform some decisions, and it may be useful for some people to know that. So we do have antibody testing at Hurley for those that are interested in it, and there's certain clinical scenarios where it makes sense, if especially in pediatrics that may have late presentations of COVID-19 findings, to get that test.
Thank you, Dr. Tupper. And you know, the testing has been a really important issue for a lot of us. And again, I'm going to repeat Dr. Reynolds' statement, and if he's on, he can chime in here, that it isn't a one and done. But there are some concerns that people have expressed. And we do have one question that says, you know, there are places you have to go that you have to do your own test. And some people are concerned about the validity of that, and they're just afraid to do it themselves. So the question is, which locations are doing the test for the individual so they don't have to do it themselves? Because this individual says, I'm personally afraid to put the swab in my own nose by myself. So how can you help address this question? Because if people are afraid, they're not going to go get the testing, and we do really need to have this done.
So the various testing centers do have different means of collection. I can't speak for every testing center. We're still working in a model where we are having a medical provider perform the swab. But there are various centers and testing centers that are doing patient self swabs, and there's even been FDA approved home kits that are obviously self swab. So I certainly can call the testing center and find out how the test is performed if that is a concern. With regards to the types of swabs, there are a number of different techniques that have been validated on a number of different platforms. So the most well-known is sort of that deep nasopharyngeal swab that goes really to the back of the pharynx. But there are methodologies that have been validated for a anterior nose swab where you get both sides. And the studies at this point indicate that the accuracy of these tests is fairly similar. So I think probably most of the testing centers that are using self swabs are not doing the deep swab, would be my guess. They're doing a more of a shallow, both sides in the nose, each side for a certain period of time. And appropriately collected, the accuracy of that specimen collection is comparable. But certainly call the testing center, ask them how they're performing the swab if that is a concern. There are certainly testing centers that are performed by a medical provider.
Thank you. So can you speak, Sherry, to specifics? I know that you mentioned that the antibody test is not done on site, but what about your location?
Our drive-through testing locations, as well as any patients who outside of our Tuesday, Thursday timeframe on Monday, Wednesday, and Friday, we do have clinicians administering the COVID-19 test. using the nasopharyngeal swab. Again, the antibody testing is a blood test, so that would be something that you would need to go into the clinic for.
Okay. So we do see it's important that when we're interested in these topics, we do need to call the numbers that are provided for you. But we appreciate those of you that are on the line giving us those insights. Another really big issue that came forward as we listened for updates from the city. Dr. Reynolds, we talked about this coming flu season and wanting to make sure that people understand this is an important issue as well. So Dr. Reynolds, can you speak to this for us? I see he's unmuted. Dr. Reynolds? Okay. While we're waiting
If
for
you don't
him.
understand anything else I say on this session, there is an app for iPhone and Android. It is the CDC Immunization App, and it can direct you for what you need according to your age, and it can advise you what immunizations you need so that you can proceed. Now, if we all can't get those immunizations at our physician's office, the pharmacies, Rite Aid and Walgreens, and I think CVS also do provide immunizations. So keep this in mind. Ideally, you should go to your medical home for those immunizations. So there's a group for children 0 to 5. There's a group for children 6 to 18, and then there's for the rest of us. And except for some very specific things that you must talk over with your provider, you can get that information. And you look at this long list, and compared to when I started practice, this list has probably tripled. It offers different immunizations, but the bottom line is this: you must be up to date. And why am I talking about immunizations now? Because everybody's talking about a vaccine may come for COVID, and it may take another year, it may take another 2 years before it provides herd immunity for a community or a group of people. But the most important thing is get your immunizations now if you're behind in anything, so that when the regular influenza vaccine is available in August, you're caught up. You don't have to delay that immunization, because some immunizations require a six week wait between them. Some immunizations can be given together. So check your immunization status. You can check with your physician, and then you also need to get caught up so that when August comes and the new influenza vaccine is available, you can get it. And at some time in the future, should the COVID vaccine come out and it's safe and it's effective and protective, you can schedule that in your catch-up immunization schedule for the future. Yvonne, have I been clear on that?
I think, Doc, you said not a one and done on the COVID testing, and you increasingly encourage the immunizations for all of us, adults and children alike. So I appreciate that. I also want to bring into the conversation at this point Dr. Susan Wolford, who is also a pediatrician. And she brought up some very important points about immunizations for children and how important it is for both parent and children to be involved in this conversation. So Dr. Wolford, can you give us your insights?
Hi, thank you so much, Yvonne. Yes, I'd like to just really echo Dr. Reynolds' comments. A few weeks ago, we mentioned this, and we just want to mention it again, that children, we know that since this pandemic has hit, the number of children who are up to date on their immunizations has decreased significantly. And that's for children less than 5 years old and for older children as well. And so we want to be sure that the children that we care for are up to date. If Tricia, if you'd let me share my screen briefly, I want to show that children who are, we know that certain communities are more impacted by disparities than others. And I'm just going to show you here again about these immunizations. And you can see that for children who are less than 5 months old, we used to have 2 out of 3 of them up to date for shots. Now less than half are up to date. And when that happens, they are now at risk for these lists of things that Dr. Reynolds mentioned. And I'm not going to go over them again today. You can look back at old webinars to see. But they're at risk for a recurrence of illnesses that we haven't seen in years. But they can come back if we do not immunize our children. We know that children who are African American are at increased risk of dying while they're children compared to other races. We know that infants, if you have a Black child, who they are 2 times more likely to die before their first birthday than our white children. So we need to protect our children. And one of the ways we can do that is by immunizing them. So thank you for letting me emphasize again the importance of immunizing children and parents getting immunized so they can protect the kids who are too young to have shots.
Thank you, Dr. Wolford. And this is really critical.
And
We've been
grandparents in there also.
All right, Dr. Reynolds.
Yes, grandparents and guardians and aunties and everybody who's going to be around the child you love.
Right.
Amen.
I my own experience when I call her my granny, my son's first child was born, and I thought about going to visit, and it was around, she was born in December, and I thought, my God, if I take her something, she may not make it. So it really prompted me to recognize the importance of my caring for myself, because in doing that, I'm caring for my child and my child's child. So this is an intergenerational conversation. And you may be wondering why we're talking about immunizations, why we're talking about COVID. And I want to throw this back to the docs at the hospitals, because many of the things that happen affect how we get treatment in our hospital centers. And I would really like for them to share with us, what are the impact? We don't have a vaccine for COVID right now. And if we have all these other underlying conditions or a possibility of having conditions because we are not properly cared for, how does that impact our ability to effectively utilize the hospital system? I want to throw that first to you, Dr. Patel, if you could give us some insights on that.
What I'd like to start off by saying is that, earlier on, we talked about the fact that we're still in the middle of the pandemic. And in the narrative that we're giving about the community making sure that they continue to follow the CDC guidelines and follow the directives to continue to perform hand hygiene, social distancing, et cetera. What we need to make sure is that included in that narrative is a conversation about if you have a medical condition that needs attention, that we need to seek that attention from healthcare providers immediately. And that narrative, that portion of the narrative seems to be missing. And we need to include it, and I would even suggest make that the first part of the narrative. Let's start to do that, because what we have seen in the last 3 months is that we have essentially told the community to just stay home. And when you give a narrative like that, it doesn't matter the caveats that you add later. Right. No one's going to listen to that. All they're going to hear is stay at home. And so now these individuals are sustaining strokes and heart attacks at home. And if they had come in a timely fashion, we could do something about it. And now they're showing up at the hospital and their stroke is completed. There is nothing more I can offer in the hospital. And that's unfortunate. And we've seen several cases, and my colleague at Hurley, Dr. Tupper, can echo that. And it's just unfortunate that we've seen that. So, the narrative that we've been promoting now, the health systems, whether it's McLaren, Ascension, or Hurley, here in Genesee County, is the fact that that you are safe if you come to the hospital. We've learned a lot since February. And a lot of the stuff that we've been doing during this pandemic is no different than what we've done with other infectious disease issues. We had an Ebola scare in 2015, 2016. A lot of the things that we learned from that, and we didn't have a single patient, but a lot of the things that we learned from that, we've incorporated, and all of these hospitals and the health systems have been able to adopt. The difference is we actually had patients this time. And so this was not a drill. We actually were live and conducting this, but because of that, we've been able to show that we've been effective in being able to deal with the pandemic as well as what other emergencies have come through. And so it's unfortunate, I hear the pediatricians on the line talking about, the children not getting vaccinated and immunized, and that's just unfortunate. And it's just part of this narrative that just isn't being promoted right now and being stressed. And we're starting to see it now, but I can tell you we're still seeing individuals showing up at the hospital too late. And I appreciate everyone's comments on the call and in helping to promote it. We just need to get that message out and maybe flip the script. Let's talk about the message of seeking healthcare for those emergencies, and then secondarily talking about everything else that we need to talk about. So.
Thank you, Dr. Patel. It's challenging because we're trying to promote this in a positive way, and yet our reality is that there's a lot of fear and mistrust. Absolutely. We talked about immunizations, but I can't tell you, and even one of the comments here in our Q&A is, people don't trust immunizations, even though they've been around for a long time. So we have
what
a
I
lot.
would say is, I must insist, if you don't trust immunizations, you should trust the germs and the viruses that cause the disease even more. You should distrust them even more. When I started practice, I would do a spinal tap when I suspected a child had meningitis. And instead of coming out clear like water, it would come out looking like ice cream. There was so much pus and infection in there that was damaging the child's brain. And as Dr. Patel alluded to, it's too late then. So we really need to prevent these conditions. And may I just add one more thing? If you're in that 20 to 40 age group where you think nothing can happen to you, God bless you, and I hope that's true. But we have to do these things to protect the other people around us, our children and our families. So these are the things that we must keep in mind. Thank you.
Thank you, Dr. Reynolds. And I just want to interject here. We have a number of our community health workers, health navigators, those individuals who are actually out in the field talking to families. Our hope is that even though there's some degree of uncertainty about a lot of things, that we're able to get some unified messages. So I appreciate what you said, Dr. Patel. We do have to change the narrative. And that's not easy. Once you got it in your mind, don't go. It's not easy to change that. But it's so important for us to think about what we're going to do to protect our communities.
I think I was just going to add, I think it made sense at the end of February, beginning of March, to have that narrative. It made sense because we didn't really understand the complexity of this pandemic, and it made sense then, but we've learned a lot, and this is the opportunity now to sort of flip that script. And I think both messages can be given. I think both messages can be given, that you seek healthcare when you need that help, but at the same time, when you're out in the community, you continue to practice social distancing, proper hand hygiene, etc.
So this is
I think many.
Yes, Dr.
I think many clinics have taken steps that would make people feel a little bit more comfortable about coming in. So in some cases, well visits are done in the morning so that sicker kids come in the afternoon. So if you're well, you're less likely to come in contact with them. There's a lot more cleaning that happens between patients going into the same room. And now, of course, everybody in the clinic is wearing a mask. So there are measures that should hopefully make people just feel that much more comfortable coming in.
Thank you. And so again, we get back to the issue of having a medical home, because if you got a doc that you can talk to, a family practice physician or primary care physician, somebody that you can go to and get these insights. But certainly what we do want to avoid is people just staying at home and doing nothing. We need to be proactive. And I appreciate those of you that are putting the questions into the question box, because we can respond to them. I'm going to ask the panelists again, if you would look in there and answer the questions, and it would be helpful if we answered to them all. But because we have people who are on YouTube and on the phone, I want to put a couple of things out here that we were told. I was advised that the Michigan Health Specialist, one of the testing sites, they only do the nasopharyngeal, I hope I said that right, swabs at both locations. That's the Michigan Health Specialist. And so they do not do any of the self-testing at their site. So if you're concerned about that, go to the Michigan Health Specialist. They will be happy to help you. And again, we want to thank, and Dr. Patel, you got that great picture up there, and somebody wants to know where you're from. But Dr. Patel is working with us today from McLaren Medical Center, a regional medical center. So Dr. Patel, we thank you for being on with us today. And this issue about not trusting the immunizations. We thank the participant for that question, because it is true. Some people don't trust. That's why our continual education is so important. And I appreciate what you're saying, Dr. Reynolds. When we think about the impact of these issues, it's better to try to figure out questions up front than have to deal with the aftermath of those things. So I'll
just reiterate, I was born in 1952. We got polio, measles, mumps, chickenpox, and all these have serious complications. And that's the reason why we had these immunizations developed. And see, we succeeded so well in getting folks immunized, even though it's not perfect, that many people have not seen this among themselves or among their grandparents. So it is real. The germs don't go away. The viruses don't go away. They are out there. And it's the immunizations that we have that protect us.
Thank you, Dr. Reynolds. I want to go back. One of the questions talks about, it references contact tracing and when a person is exposed to COVID. And now we're seeing that we're out and about, and if you get a call or you find out that you were, and this may go back to you, Suzanne, at the health department, you get a call that you've been exposed to someone, what are the recommendations? And I know it's been talked about before, but every time we have an opportunity to provide this education, it's so critically important. What are the steps? What should people do when they get a call that says you may have been exposed to someone who has tested positive for COVID-19? I hope she didn't get, all right. Looks like she may have gotten.
Hi, Yvonne.
There you go. All right.
I just don't have my camera on today.
Okay, Kim, thanks.
So if you get a call that you were exposed to COVID-19, they will tell you that you are going to need to quarantine yourself for 14 days, which means 14 days from the date that you were exposed, which means you should stay home, not go out in public, try and distance yourself from your family to help protect them. And part of that call is that contact tracing. So they will be calling, likely from the state, for the next couple of weeks. We did get an update. We are in the transition in the next couple of weeks that those calls will be coming from our local volunteers sometime after the 4th of July. But you will get a call from the state. If you're on a landline, the caller ID will say My COVID Help. If you're on a cell phone, it will be an 866 number. They will ask you to identify yourself, give your name and your date of birth so that they can verify that they're speaking to the right person. And they will give you information on what you need to do, offer to email you information or text you information if you have the capabilities. If you don't have the capabilities, they will get your address and mail it to you. And then you need to monitor yourself for the next 14 days, and they will attempt to call you every day to check on your symptoms, to check and see if you've developed a fever, a sore throat, a cough, any of the things related to COVID. We also have a texting app that they will offer to sign you up on so that you don't have to answer the phone. You can just answer a text to give them that information. As I said, they follow that up for 14 days. They will call you every day until you answer them. They're very persistent. And then if during that time you develop symptoms, they will change you over to our tracking device at the local health department, where you will be connected with one of our nurses, one of our case investigators, who would then contact you and discuss what type of symptoms you're having, whether or not you should follow up with your healthcare provider at that point, give you information on testing, where you should go to be tested, where you can go to be tested. And then just a reminder, anytime you get a call like that, they will not be asking for any personal, financial, tax, Social Security information. They only are interested in health information and making sure that they are talking to the correct person. Did I miss anything for you there, Yvonne?
I think you covered it. There's one other thing for Suzanne. You had one final point you wanted to make as you were wrapping up your comments earlier. Can you give us that really important piece of information?
It's been everything that we've just been talking about. The key thing for that fifth point is the importance of maintaining our own health. And as you've heard from everyone, that the messaging has been about staying at home. We don't want people to neglect their health. So if you have a chronic condition, please maintain it. Communicate with the person that you have as your medical home. Make sure that you eat well, that you get sleep, that you are exercising, that you take care of both your physical and your mental health. Do those preventive screenings. And again, make sure you get immunized, and particularly for the flu immunization in the fall. We're going to be having COVID-19 at the same time we have influenza. It's really important that everyone do everything they can to maintain their health. And so everything that everyone's just shared with you is that key fifth message. Please make sure to take care of you.
Thank you, Suzanne. I want to just go back. Dr. Patel, this is your first time joining us today, and so appreciate your insight. I was so appreciative of some of the things you shared when we updated and kind of prepared for today. I just want to offer you another opportunity to give us an update in your perspective on some of the things that are happening from the hospital perspective, what you would like to leave us with today. Dr. Patel.
Sorry. Right. So I think that there's so much going on out in the community, and it's important that leaders of all kinds take their platforms that they have to promote all of the good things. And it's unfortunate when some leaders do get up on their platforms and promote all kinds of vile information and incorrect information. We've seen that all throughout this pandemic, and unfortunately even more so in the last few weeks. When we talk about healthcare, it's again important to understand that healthcare, these conditions don't stop for a pandemic, and every opportunity that we have to get out in front of the community as leaders, we need to make sure that, number one, we're keeping our community safe, but number two, to make sure that we promote the access that the community has to obtaining proper health care. You and I had spoken yesterday about some things that were just very disturbing, even just this week, and I don't want to get into it now, but it's, to have leaders of all kinds step up and promote inaccurate messages is just, it's heartbreaking to see that. For those of us that are, many of us that are on this call as part of the panelists, we're the ones that are here. We love what we do. We're here to promote healthcare. We're here to promote the health of the community and the citizens of the community. It's I was just reading some of the Q&As and some of the questions about the community not trusting immunizations, and Dr. Reynolds had spoken a lot about that as well, and that's just disheartening. And some of that is because we don't have a singular message that promotes healthy living. My hope is that someday we will have a much more unified voice and a much more unified message, and obviously not just for healthcare, but for a lot of things in society. And but until we get there, we just continue to plug what we do and make sure that that we, as leaders within the hospitals, leaders within the health department, and other healthcare leaders, that we continue to promote the healthy message.
Thank you, Dr. Patel. I want to take a minute. We haven't done this before, but you've heard us express our appreciation to all of the panelists that have come on. I want to ask that we go to gallery view, and we'll stop the Zoom, the PowerPoint for a moment, because I would like our participants to see the persons that are behind the scenes every week when they can be, to share this information with you. It's really important for us to understand that it's a busy season, but there are people in leadership spots that are committed to helping make sure that our community gets the best information that they have. So I don't know if our tech can make that happen for me, that we can see everybody. You may not see their faces, but I do want you to see their names. So they are here for us as community. I stand as one that is real clear about, no matter what the other activities I do, I'm a community person. And we're committed to helping get this word out in a positive way. So those of you that are listening and watching and putting your question in, you're equally valuable, because your questions help guide the discussions that we're having every week. So I want to applaud you for having those questions. I want to thank those of you now that you see that are the faces behind making all of this work. Much appreciation, because it could not happen without you. So we go back to gallery, to the screen. Patricia or Deborah, which one of you all are handling that for us today, so that we can get back to the presentation. But I just wanted to make sure that those who will be watching this webinar and going forward, they see that there are a number of people that are truly interested from the state. We even got the state of Michigan, Gary Jones. I'll give you just a quick minute to say a word to us before we go to information from partners, because you're helping us to stay on track with what the governor is doing, that the community, our city is following through on as well. So Gary, please share.
Hey, sorry about that, Yvonne. It took me a minute to get to the mute button here. So a couple quick updates here. So statewide, we are now at total confirmed cases of 62,306 for COVID-19. Total confirmed COVID-19 related deaths are now at 5,887. And total recovered COVID-19 cases as of June 19th are 49,290. And just for clarity, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So actually, recently there was a very, very recent announcement about the evictions executive order that just came out before the meeting started, that will be extended until July 15th. And also, too, comes with the creation of a evictions diversion program, which will outline a process for renters to get fast rental assistance or establish a manageable payment plan to make sure that Michiganders are allowed to stay in their homes. Also, the governor signed an executive order allowing professional sports to return to action. So this will set guidelines for a safe return of professional sports without a live audience. The order will follow the Major League Baseball announcement that a shortened 60-game season would begin on July 24th, with players reporting for spring training at their home ballparks on July 1st. The governor also recently extended an executive order allowing administrative hearings by phone and video conference to continue. And again, it will allow the state administrative hearings to be held by video conference or phone in place of in-person hearings. And this will last until July 31st of this year. The governor also extended enabling remote transactions, which is the extension of a previous order that will temporarily allow e-signatures on official documents and remote notarizations to avoid unnecessary in-person contact during the COVID-19 pandemic. And this will expire on July 31st. The governor also recently signed bills increasing healthcare access into law. These bills will increase access to healthcare for Michiganders through telemedicine and remote patient monitoring services to make sure that we're ensuring these services will be covered by insurers as well as Medicaid. These bills essentially codify significant pieces of a previous order, which broadly expand access to telemedicine as part of Michigan's emergency response to COVID-19. The governor also signed an order that reestablished the Michigan Statewide Independent Living Council. So through this order, reestablishing the council will ensure compliance with current requirements under federal law and strengthen working relationships among the council and entities providing services to individuals with disabilities, Centers for Independent Living, and other programs. The applications will be due by July 8th, and the order itself will take effect, July 15th. And always as a reminder to everyone to keep updated with everything, michigan.gov/coronavirus is still the best website to stay updated.
Thank you, Gary. And as we are looking, it seems like the time goes by so quickly as we start our conversations. But I want to remind you, at the top of the hour, we started with Dr. Deborah Furholden giving us some good insights, and I'm going to ask her to wrap this up, but I want to go to some information from community partners, because one of the things that we've often been asked is how do we deal with the stressors? And so one of our partners has support groups that they're offering, and I must emphasize, we're still dealing with the water crisis. And so that on top of COVID, the layers that we are experiencing are continuing. And we need some place to go. And it was mentioned earlier in a conversation that youth are struggling, our parents are struggling. So if you are in need of some support, these sessions are available to you to get support. And these are some of our community members who are working to assist in that. So there are adult sessions and youth sessions that are organized. Please feel free to go on to the webinar and look specifically at these dates and times. And if you need assistance, please, please don't sit at home in silence. You can get some support from someone. You may not want to talk to a family member, but you can get some support from somewhere. So I want to go back and ask Dr. Deborah if she would give us some closing thoughts about what was spoken of earlier. And remember, you'll get that pop-up evaluation immediately following the webinar. Dr. Deborah.
Hi, Yvonne. I want to just again thank all of the panelists and the participants. You know, I think we've gotten some really important information in the face of the stay-at-home order. It does not mean stay at home if you are dealing with a health challenge. You are safe to go to our hospitals. As Dr. Patel said, we have learned a lot, and I think I really applaud our hospital system for rising up to meet the challenge of keeping our citizens safe during this time. I just can't stress enough, and somebody asked, how do you graciously let people know that we're still in the midst of a pandemic? I'll just say this, me telling your loved ones that this is far from over will not carry the same weight as you telling them that. So I do encourage people, the previous webinars that we've done that I think provide very important and relevant information because it came right from our partners are available on our YouTube channel. Any one of those videos give good insight and information, but it's really important that we stand not just for ourselves, but for the people that we can impact and the ones that we love. I think we can emerge through this, but only if people do their part. And so I really encourage people to stand in. I am my brother's keeper. This is the season where we all have to come together and do what we can to keep our community safe.
Thank you, Dr. Deborah. So we know today is June 26th. So if you're looking at that, we're talking about next webinar will be actually July 2nd. July 2nd, July 3rd, July 2nd. Yes, July 2nd. So please, we look forward to you being with us next week. for a webinar. We're going to pay close attention to the things that you've shared with us today. Please subscribe to our YouTube channel, Healthy Flint, so that we can make sure that no limitations are in your way. And if you need any additional information, questions or information, send a note to us at info@healthyflint.org. We want to thank you for joining us today. We hope that you've benefited from this session. And remember, you are the one that will make the difference. Protect yourself and protect your families. And we'll look forward to talking with you again next week. Thank you all.